I think many clinicians realise that they will be taking leadership roles as they progress in their careers. But I think for me, certainly I began as a service lead and then progressed to a clinical director and ultimately progressed now to being the medical director of one of the largest NHS provider organisations. I think during that I realised that whereas many clinicians are in that first level managing their patients for superb outcomes, there are a smaller number who are interested in managing services in aggregate, and a smaller number again who are interested in managing organisations. And certainly as I progressed through my leadership journey, I felt that I had something to offer and something to learn by managing at the organisational level, particularly as now organisations are part of systems of healthcare, and I'm particularly interested in that. I was very, very strongly influenced very early in my career by a charismatic leader, Dr Ogg, and he really was a mentor and an inspirational leader who, through his passion and his tenacity, really was responsible for much of the growth of access to life-saving treatment like kidney dialysis. I've got a number of tips for aspiring leaders, particularly in medicine, and particularly those that want to move on to perhaps the higher levels of organisational leadership. The first is that it's clearly important to understand the why and the what of leadership, particularly in the context of your organisation. It's very important that leaders go in open-eyed into the roles and they understand what is entailed by the role that they're going to take on. It's important that leaders are able to understand the task. There are many upsides of going into leadership as a clinician, but there are some downsides. The second and probably most important tip is that they are passionate about the service and the organisation that they're going on to lead, because certainly authentic leadership, being passionate about those things that you're doing, is really a key attribute of a successful leader. And I think thirdly, understanding how to lead, whether on occasions you're going to lead with from the front with vision and passion, or whether at other times you need to lead from behind with collaborative engagement and negotiation with colleagues. And being able to modulate your leadership style and understanding that you can modulate your leadership style is a key attribute of the successful leader. As a medical director in the NHS, I recognise quite a significant change in the last few years, and that's a change in context. The context internationally are facing similar challenges, particularly of rising demand and expectation for healthcare, challenges of the financing of healthcare, and importantly challenges in maintaining very high quality outcomes for patients, both in terms of patient safety and patient experience, balanced against those demand and economic pressures. It's very important, I think, that medical directors of the future understand the context that they're operating in and that they have a balanced approach to those competing demands, but importantly that they keep quality, the safety of our patients and the experience of care that our patients have at the absolute forefront of their minds. Challenges facing doctors now, and the biggest challenge I think to the next generation, I probably think about three particular challenges. The first is certainly in the UK and worldwide, we've seen major advances in technology, we've seen major advances in devices and drugs, which have given patients massive new opportunities for fantastic outcomes. However, we recognise that that comes at a cost, and it's very important for doctors to understand the value equation in healthcare, that outcomes over cost is an equation that we continually have to balance to ensure that all patients have the best equitable access to care. I think the next major challenge is a change in the types of roles that doctors are doing now compared to those of some years ago, really as being part of a multi-professional team, and understanding the importance and how to work within a multi-professional team is key. I think the last challenge, which is the challenge for the future generation, is making sense of the new sciences, for example, of genomics and computing, where the information about patients will be presented to this new generation of doctors in a very different way, and they need to make sense of that while maintaining the skills that they've had traditionally. One of the things I would say first and foremost, one of the reasons that I have taken the route and the roles that I have, is that I'm very passionate about high quality outcomes for patients. I love clinical medicine, but I've really been privileged to have the opportunity to guide an organisation as it cares for many more patients than I would care for just by myself. For example, Guy's and St Thomas's sees 2 million patients every year, and having an ability to influence the care that that very large number of patients receives is a great privilege. I think the second thing that I would say about myself is that I relish relationships. I think one of the most important things that we are able to do as leaders is to build relationships that last with all of the staff of our organisation. Guy's and St Thomas's has nearly 14,000 staff, and I hope that at some time during my tenure as a leader in this organisation I would have met most of them, and I hope that many of them will be happy to call me by my first name. I think that's a mark of success in leadership, is the engagement and the relationships that you develop with staff. And then lastly, one of the things that might not be immediately apparent is that I am the Health and Wellbeing Ambassador for the Trust, and I've been privileged to take part in a number of sporting events with many of our staff, particularly to raise funds for good causes within the hospital. So for example, I recently was able with many of our staff to abseil from the top of the North Wing down to the ground over a fantastic day where we raised £100,000 for the new cancer centre. So that's a fantastic opportunity for me both to meet our staff but also to take part in some of the really enjoyable events that we organise at Guy's and St Thomas's. It's really important that as an organisation we have a leadership that's representative of the constituency, both of our patients but also of our staff. Importantly, therefore, it's very important that the organisation enables women to take senior leadership positions, and I'm glad to say at Guy's and St Thomas's I think we're achieving that. Certainly looking around the board table the other day, I think the balance of male and female members of the board was approximately 50-50. So I think we've got great representation at the higher levels of leadership in this organisation. I hope that's replicated in all organisations. Importantly, in our academic life, we are currently going through an application to the National Institutes of Health Research Biomedical Research Centre bid, and very importantly in that is